हाँ वो बोले तो भी बच्चे अपना चार बोले चार सेकंड्स
क्योंकि मैं पार्टिसिपेंट्स को देख नहीं रहा था। अच्छा
This is Kanchipuram, na?
अच्छा अच्छा अच्छा
This is Kanchipuram. It's Kanchipuram. My coffee. That is जोधपुर नहीं कनेक्ट हुआ।
जोधपुर अभी 2 मिनट में हो जाएगा।
Where are people expert are we? All of you should be there. अपन को भी कर दो। क्या है कविता आपकी? एंटर करिए। एक्सपर्ट आ गए पार्टिसिपेंट से पहले तो जरा पूछ सकते हैं कल रोज एक ही सेशन में दोनों सेशन एक ही कर लेना प्लीज कंप्लेंट आपके स्टूडेंट्स को बता देना
आज कौन आ रहे हैं इस सेशन के लिए?
सरदारा सर
अच्छा
पूरा ही पूरा कोर्स में ये सहयोगी बल पे कर रही हूँ Because we don't have much expertise in this area yet. Other than CDAC में एक टाइम तो कानपुर से होता था अभी उधर भी बहुत कम है
कानपुर से भी सीएसआई भी थे
he started he was the I think he was the first director of CDAC at that time उसका नाम कुछ ETDC कुछ था
CDTI
उसके बाद उन्होंने ETDC शुरू किया था फिर अभी CDAC
हो गया
फिर बायोमेडिकल में ठाकुर में थोड़ा पहले सानी साहब जब था
देखिए सानी से
अभी उधर भी नहीं है ना बायोमेडिकल में इतना स्ट्रॉन्ग एरिया
ये है रविंद्र अग्रवाल सर है
अपना अग्रवाल माइंड क्योंकि वो एक ही है और फैकल्टी मेंबर्स नहीं है यंग फैकल्टी मेंबर्स नहीं है और सब वगैरह मेरा एज का है
उनका और ये अमोद कुमार सर का ऑलमोस्ट सिमिलर है तो जो ये करते हैं ना ईएमजी बेस्ड रिसर्च करते हैं
इमेजिंग में नहीं कल सदाना सर आए थे तो मैंने उनको बोला था जितेंद्र वर्मा भी आ रहे हैं वो कौन सा टॉपिक मिलेगा तो मैंने बोला आपका सपना मैं तो एक्सरे में करूंगा थ्योरी आपकी मैंने बोला तो ये डाउट था कहीं आप लोगों का सेम तो ना हो इट शुड नॉट बी रिपीटेड नो डोंट वरी आई विल
मुझे यहाँ से इसमें से करना है पीडी से पीपीटी कर ले
इधर इधर
मैम के लिए पार्टिसिपेंट्स है मोस्टली ये मतलब टीचर्स हैं वो जहाँ पे ये हो रहा है उसके नियर बाई कॉलेजेस के
कुछ कॉलेजेस में है ना बायोमेडिकल इंस्ट्रूमेंटेशन का कोर्स भी होता है
अच्छा
कुछ कॉलेजेस में सब्जेक्ट ऐसे सब्जेक्ट है कुछ कॉलेजेस में एज अ डिग्री है
अच्छा
so they require the teachers require information ये जो कांचीपुरम का कॉलेज सबसे मेरे को फोन करते हैं
अच्छा
and we are interested in this course we are interested in this course
अच्छा
तो ये कोर्स के पहले 10 बार ही उन्होंने मेरे को कॉल किया
अच्छा
2-3 महीने पहले उन्होंने अप्लाई किया तब हम we usually we do not do course on biomedical because
अच्छा।
when we our department we don't have experience. But some students wanted to do because we also have instrumentation
जी।
subject.
हाँ।
So students want to do thesis. So some of the students are doing PhD and ME thesis in biomedical. And we
Okay.
have an EMG एक myotrace का
अच्छा।
जो है एक EEG का भी
हाँ वो जो बायोपैक वाला है। हाँ।
एक EEG का भी अभी हमने लिया है EEG सब रहता है
अच्छा।
वो भी लिया है मैट लैंग्वेज तो दो इक्विपमेंट हमने लिया है फॉर प्रिसिशन so that students can work on this इमेजिंग पार्ट भी है या सिग्नल प्रोसेसिंग सपोर्टेड कंडीशनिंग क्लासिफिकेशन सब में काम कर सकता है
ऐसे ब्रॉडकास्ट तो हो जाएगा कोई इशू नहीं है पर वहाँ से कंट्रोल करना
मेरी पीडीएफ फाइल है
कोई इशू नहीं है ये नहीं सर
मैं ये बोलना चाहते हैं
इधर में
बैठ के ऐसी बोलना। अच्छा
कैमरा इधर ऐसे आपके सर में रखा है
अच्छा।
looking to the camera so that
Okay. Okay.
it will be uploaded. They will be able to hear you.
अच्छा।
When they ask you questions, they can interfere.
Okay.
So they can ask you questions.
Okay.
So they can answer.
Okay.
So he will control whether he has to send your PPT or your face. So he will do both.
Okay. Depending upon अच्छा।
क्या उधर जा रहे हैं
अच्छा।
तो अगर आप उधर ज्यादा देखने से ना फिर कैमरा में उनको ना कहीं और देखने लायक लगता है तो आप ज्यादा कैमरा में ही
मैं ज्यादा कैमरा में ही देखूं और मतलब इधर आई विल लुक एट माय पीपीटी और एट कैमरा
but what they are seeing will be seen from here because they will also be seeing it na?
Okay.
They are also listening here so they for them they should see the transparencies the slides
Okay.
so when they ask
But these slides will be visible to them as well.
that he will be controlling both slide
Okay.
share and your face.
Okay.
It's simply Google Hangout for you.
Okay.
And it goes into YouTube.
Okay. When I am looking at my slides, then he will show the slides. When I am looking at the camera, then he will show my face. That is what
Depends on the they
later it will be uploaded on YouTube also.
This actually what I do is
I have seen many lectures of yeah.
what yesterday because I didn't have time to sit here. मैं क्लास शुरू करके अमोल सर का क्लास शुरू करके मैं अपने रूम में जाके YouTube ऑन करके मैं पूरा टाइम इस पे चला कैसे आना मेरे को सब पता चल रहा था so we said now we can have tea for some time and then people were discussing tea सर का चाय इधर ही आ रहा था
अच्छा
I think ठीक जाता है आज फिर 3 घंटे लगातार नहीं है ना
सर कितने बजे आएंगे सर
सदन सर 11 बजे
अच्छा
मच स्टूडेंट्स नहीं है ना आप लोग ही है ना हाँ सेकंड ईयर कल वैसे कुछ चाय 20 चाय या देखो वो हम स्टूडेंट्स को उस फंड में डाल देंगे बिकॉज मैंने वो एक्सपोर्ट लेक्चर के उस पे किया ना उनके डाल चाय सब हो जाएगा
यानी we use a pointer वैसे नहीं हो सकता है कि नहीं वैसे ही मोड से ठीक है ठीक है ठीक है ठीक है
तो मिनी मैथी बोल रही हूँ मैं शुरू करते हैं पिछला लेट हो रहा है क्या टाइम पकड़ते हो गया
शुरू कर दीजिए यहाँ नहीं है पॉडकास्ट हो रहा है
पॉडकास्ट हो रहा है इधर क्या हो रहा है स्लाइड्स नहीं दिख पा रहे
2 मिनट से लगे
हाँ ठीक है आई विल स्टार्ट तो कर ले good morning to the centers participants at the centers. Today is the third day of the program and good morning to the participants here also. मैडम तो मिले नहीं कल भी नहीं आई लेट आए थे सर्टिफिकेट नहीं मिलेगा if you miss classes okay okay then so we have Dr. Jitendra Vermani with us scientist at CSIO. He has done his MTech and PhD from IIT Roorkee, worked on biomedical images, ultrasound images. So he will be discussing on analysis of images for renal diseases. So I think it's almost 15 minutes late. He has only 1.5 hours with him, so I should not be in between. So that I'm handing over the mic to Dr. Jitendra Varmani. Over to you, sir. Thank you.
A very good morning to all of you. Well, I will be talking about analysis of medical images for diagnosis of particular diseases using ultrasound images. Now, these days, what happens is that we have large amount of medical data, and the clinician time is very important. So basically, when the radiologist they look at a particular image in order to diagnose a particular disease, in this area what we try to do is that we select a particular disease, collect the image database from the hospital, and then we collaborate with the radiologist, and then we try to look at what radiologist is looking at a particular disease, and then we try to embed that particular knowledge in order to develop a system which is known as computer aided diagnostic system. Now, just let me tell you what computer aided diagnostic system is and how it is helpful. So a computer aided diagnostic system essentially means that, if see, in the field of radiology, when the junior residents are there, they are always working under consultants, and it is by looking at the images they gain expertise to predict whether a particular lesion is benign or malignant. So let me tell you what first of all a tumor is. Tumor is extra growth of cells. Now, in normal functioning of human body, what happens is that the old cells they die out and the new cells take their place. But if this function is, the rate at which the new cells are formed should be equal to the rate at which the old cell die out. Now, if let us suppose the old cells are not dying out and the new cells are forming, there will be an extra growth, and that extra growth is actually known as a tumor. Now, tumor is basically extra growth of cells. Now, this tumor can be a benign tumor or it can be a malignant tumor. Now, benign tumor means cancer is there, but it is not. It is in the safe zone. It will not spread to the other parts of the body. But on the other hand, if the tumor is malignant, it means it is a tumor which is cancerous, and it can spread to the other parts of the body through bloodstream. Means the cancerous cells will flow through the bloodstream and will affect the different parts of the body. Like, let us suppose liver. Liver is the largest organ of the human body. Now, being the largest organ of the human body, it is exposed, it is very much vulnerable that cancer cells, through, if they are having primary somewhere else, let us suppose primary is throat cancer. Now, the cancerous cells from throat can, through blood vessels, they can attack on liver. Then the liver, it will develop liver cancer also. But liver cancer in that particular case is a secondary cancer, and throat cancer is a primary cancer. Liver, being an organ with the largest area, it is very much likely that it will be attacked by secondary cancers having primary somewhere else. So metastatic cancer is one type of a cancer which is very common in liver. Now, if the radiologist has to find out of if the patient visits a hospital and the patient is symptomatic, it means there are symptoms which indicate that there can be a cancer to this particular patient. Then the doctors will have two options: either to go for imaging studies, or which may be X-ray, ultrasound, MRI, CT scan, PET scan. Now, which particular imaging modality is well suited for which organ, this is a different aspect. Now, first thing is, the doctor, if it is a soft tissue, the doctor will prefer ultrasound. If it is a bone fracture or something, the doctor will prefer X-ray examination. Now, in case of in case of breast tissue, in breast tissue there is no bone, it is a soft tissue. So doctor will prefer, in that case, mammography is either preferred or ultrasound is preferred. Now, depending upon if the patient is symptomatic, first certain imaging studies are carried out, or the patient is asked to undertake ultrasound examination or X-ray examination. Now, when the junior doctor will look at the particular ultrasound image, he will have to identify the region of interest where the tumor is there, and from his expertise, he should be able to diagnose whether a particular tumor is a benign tumor or a malignant tumor. Now, this expertise takes a lot of years to develop, so they are not confident on their diagnosis. So what they will do, they will contact the senior consultant and they will ask them that this particular lesion is appearing to be cancerous or malignant. Then the consultant will confirm it whether it is this or not. So we what we are trying to do is that, because the radiologist will, when they want to diagnose from imaging studies that a particular lesion is benign or malignant, they will look at the region inside the lesion. Now there are two things they will look at depending upon that particular lesion has developed on which organ. Like if you look at the breast lesions, then the margin features as well as the texture features both are important. So texture, when I say a word texture, texture means it defines the properties of the surface. Like if you can look at the shirt I am wearing, there are checks in it, so this is a periodic texture. If you look at the table out here, I can feel it that this is a very smooth texture. So the doctors, while looking at the images, will identify the texture of the affected region, that is the lesion. The If you talk about ultrasound, the texture can be of four types. It can be hyperechoic texture, hypoechoic texture, isoechoic texture, anechoic texture. Like all of you might have seen the image of a cyst on an ultrasound. So the cyst appears black on an ultrasound image because it is, we say that it is anechoic texture. Now, anything, let us suppose liver is the large organ, and if I am talking about focal liver disease, it means it is affecting only a certain portion of the liver. Diffuse liver disease means it is affecting the whole liver parenchyma. So, whenever there is a mass or a tumor, it will affect only the certain part of the ultrasound image. So, it is a focal liver disease. Now, that particular lesion can have hyperechoic appearance. It means it will appear bright in comparison to background. Hyperechoic. Hypoechoic means it will appear dark in comparison to the background. Isoechoic means the echogenicity will be same as with respect to the background. Anechoic means it will appear black. So radiologist, we have to talk with the doctor and we have to see how he is reporting. He will report that if it is a hyperechoic lesion, the doctor is going to report that hyperechoic lesion with homogeneous texture is found on the liver. Now, basically, in case of breast lesions, if the margin of the lesion is not regular, it is irregular, star-like, it is not circumscribed, it indicates that the lesion is malignant. If the margin of the lesion is well circumscribed, it is circular, it is elliptical, we say that it is benign. So these are margin features which are also known as shape-based features. So when we will mark the boundary of the lesion, uh, a practicing researcher will get in touch with the radiologist. He will collect images of benign lesion as well as malignant lesion. He will sit with the radiologist and mark the boundary of the lesion. Now we have to find out certain mathematical descriptors which will tell us whether this particular shape is uniform shape, whether it is circular, or how much it approaches circularity, or whether it is well circumscribed or it is a star-like ill-defined margin. So we have mathematical descriptors which will tell about the shape of that particular lesion. Otherwise, we also have certain texture features. Texture features will tell us whether the contrast of the region inside the lesion is brighter or not, or smoothness is one of the texture parameter. So in breast lesion, if you want to develop a computer aided diagnostic system, then that particular system, it is expected that if an unknown image of a breast tissue is shown to the radiologist just have to mark a square ROI, or radiologist has to mark the boundary of the lesion. Then our system will predict whether this particular lesion is benign lesion or malignant lesion. It means after the radiologist mark the lesion boundary, our system will calculate the shape based features. Our system will calculate the, it is not broadcasting. Yes. Should I have to begin all over again?